I have bags and wrinkles under my eyes. Can this be fixed? I need to know if this can be fixed or improved. It's all I see when I look at myself.
Thank you for your question. You've submitted two photos that appear to be taken from inside your car, or at least in a place where you're slightly looking down, and you're expressing concern about the bags under the eyes and wrinkles, and you state that it's all that you see. So I'll share with you how we approach patients like yourself in our practice. I'm a cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. This means, if you're not familiar with this specialty, is that my background training was first in eye surgery and then specialized training specifically in eyelid, cosmetic and reconstructive surgery, and surgery as well as on the face and the bones around the eyes. So rejuvenating eyes is something we do every day in our practice. And so in approaching the concerns you have with the under eye area, I'll define for you how we approach this when patients come to us. There are typically two major issues. One is puffiness and two is wrinkling. So puffiness under the eyes is typically related to fat pockets. Now these are fat pockets that have nothing to do with body fat, but rather with the genetics of the anatomy around the eyes. What happens is when you have under eye bags, the fat pockets actually push forward and they prolapse and result in a bulge. This bulge of fat is, once it happens, it can't be pushed back. And people often try all kinds of over-the-counter creams and concoctions, and they generally fail to do anything. These are as a basic rule of thumb, treatments that are over the counter have a limit in how deep they can penetrate, no matter how much the manufacturers promote and advertise and have all of this great marketing. You just can't go that far into the skin to be able to reduce the volume of the fat pockets. So what we do in our specialty is address these fat pockets in a procedure called lower eyelid blepharoplasty. This means that puffy bags can be approached surgically. Now, surgery is very often a scary option because people think of hospitals and deep anesthesia. But in our practice, we have our own facilities that are certified by the Joint Commission. These are the same people that certify hospitals to make sure that office-based cosmetic surgery is performed at a very high level, equivalent to an ambulatory surgery center or a hospital in terms of our safety protocols and methods of sterilization and etc. And so we do these procedures typically under local anesthesia with light IV sedation. This means that you're given an intravenous or IV and you're given the equivalent of something like a liquid Valium that relaxes you and allows me to do the procedure. Our patients recover very quickly, typically in 1 week in terms of going back to work, and the methods of surgery depend on whether or not there's the presence or absence of excess skin. There are two approaches to the lower eyelids. One is called a transcutaneous approach, or from the outside, and the other is from the inside, called a transconjunctival approach. In order to determine which approach is best for you, requires a physical examination to determine whether or not there's excess skin. In my practice, my more popular procedure is a transconjunctival blepharoplasty. That means I'm able to avoid making an external incision, and usually people don't have extra skin, ironically, even though they feel that they have extra skin because of the appearance of wrinkles. Wrinkles under the eyes is actually due more to skin quality changes rather than skin quantity. When we talk about skin quality, we're talking about basically loss of collagen, loss of blood supply, loss of the youthful elasticity of the skin. When we approach lower eyelid skin, we employ a technology of regenerative medicine called platelet-rich plasma. Platelet-rich plasma is a concentration of the growth factors and healing factors necessary for wound healing that when drawn from your blood, which is done with like a routine blood draw that you would for going for routine labs, we're able to stimulate collagen, stimulate new blood supply, and improve the quality and color of the skin. In a lighter skinned individual, we also employ a technology called fractional CO2 laser. This is a very precise way to direct thermal energy to the skin in a way that causes skin contraction and improvement of the appearance of fine lines and wrinkles. Can't make people look like they're 25 again, but we can certainly build up the collagen and improve the appearance. So this dual approach is very typical in our practice. I would also mention to you that sometimes when people look at themselves and focus under the eyes, the under eye bags, they sometimes miss that they also have hooding in the upper eyelids, and I would respectfully mention to you that that is also present and maybe something that you'd want to address at the time of your consultation. So I would recommend that you meet with qualified, experienced cosmetic surgeons, learn about their style by looking at before and after pictures, learn about the type of sedation or anesthesia. And of course, you have to be comfortable with the doctor. I think it's critically important that you be able to communicate your concerns and set expectations for what you'd like to see occur once the procedure is completed. So I hope that was helpful. I wish you the best of luck, and thank you for your question.